What is the East Lothian Partnership?
The East Lothian Partnership is a group of organisations who are responsible for working together to support communities by listening and designing the services they need. They do this by putting together a plan that we can all work to.
Who is the East Lothian Partnership?
The East Lothian Partnership includes colleges and universities, doctors, nurses, dentists and opticians, teachers, social workers, active schools, families together, community and youth workers, fire, police, shops and businesses, and charities and community groups.
The East Lothian Partnership asked for your ideas and feedback on changes they could make across organisations to support children, young people, their families and the wider community. What did people say?
Working with partners and agencies, we listened to the key issues from 9,652 children, young people and families, and 15,007 wider community voices. The key themes they raised were poverty, safety at home and in the community, and health.
We have been using this to form the themes and priorities of the new plan. What you told us about living well.
Communities identified 4 priorities under the theme of living well: well-being, waiting well, staying connected, and being physically active.
What you told us about your well-being.
That managing your well-being affects everyone, but that there are certain groups who may be at higher risk, such as men, rural sectors and communities, people with disabilities, peri and neonatal mothers, older people, people with addictions, unaccompanied minors and care experienced. That people in support services need to help identify deterioration in mental health and well-being prior to reaching crisis, as people often find it hard to access the help and support they need when they begin to struggle. You highlighted ways to manage your well-being, including access to green spaces, leisure and well-being activities, community groups and online resources.
The East Lothian Partnership Vision for Wellbeing.
Opportunities to build and maintain well-being through early and sustained access to activities, social groups and natural spaces in East Lothian are essential. By raising awareness of supportive tools and spaces, we can work to prevent isolation and promote healthier, more connected lives.
What you told us about waiting well.
There are currently long waiting times for neurodivergence assessments, and people waiting would find it helpful to be able to access support whilst on waiting list. This may include community activities and activities that are safe and suitable for the whole family. Accessing this support could help prevent a deterioration in mental health whilst waiting. This includes support which is not specifically health related, such as social prescribing, leisure activities, peer support and resources online. You shared that whilst anyone can be affected, those more often affected include accompanied minors, children and young people, people with disabilities, those with neurodivergence, invisible communities, peri and neonatal mothers, people with long-term health conditions, and the older population. You shared that people in these groups are often unable to advocate for themselves.
The East Lothian Partnership Vision for Waiting Well.
Raising awareness of and creating spaces, resources and tools which enable healthy living and places are vital for everyone. Neuroaffirming and trauma-informed approaches ensure we create safe and inclusive spaces. Access to social and green prescribing, along with other preventative activities embedded in communities, support people before they reach crisis.
What you told us about staying connected.
That there is a need for people to have wider social connections, and there is a reduction in social circles for those later in life due to age and mobility. You shared that rural communities, older population, mothers, people with long-term health conditions, people with low incomes and young people are also affected. You told us that intergenerational activities, social prescribing, community groups, digital inclusion, accessible active travel, buggy and wheelchair friendly, and deaf friendly clubs and day centre outreach centres could improve social connection.
The East Lothian Partnership Vision for staying connected.
Communities where people of all ages, backgrounds and circumstances are supported to stay socially connected throughout their lives. By working together across generations, we strengthen well-being, promote lifelong learning and build friendships and social networks. Through the thoughtful use of technology, professionals and communities are empowered to share knowledge, access opportunities and prevent isolation.
What you told us about being physically active.
That there are a range of physical health issues which could affect everyone, but are linked most closely with those who live in deprived areas and with older populations. These include obesity, sedentary or inactive lifestyles, substance use, mobility and access. It was highlighted that climate change is affecting our health and the need for culturally appropriate services. There was recognition that some communities might find it harder to access health support, such as migrant workers, traveller and gypsy communities, and rural workers such as farmers and fishermen. Access to transport, the cost of access to health and leisure activities, and cultural backgrounds were recognised as barriers.
The East Lothian Partnership Vision for being physically active.
Everyone should be able to access green and active spaces to improve and maintain their physical health. And where barriers exist, we need to be working together to target support for these groups. Improving accessibility for all in and around our communities ensures a range of ages and abilities can be active in their daily lives. Trauma-informed, neuro-affirming and cultural humility training should help to reduce barriers and build trust to enable communities to stay active.